I don't know why I did that.
Recording in progress.
Okay, well, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada. I'm in the greater Seattle area and I help people with joint pain become pain-free and people with autoimmune diseases get their immune system back on track. Today, we have a phenomenal guest, Dr. Celine Lee. Not only is she an amazing rheumatologist and dermatologist, but she's also a dear friend of mine. She actually has spent a lot of time really going past just traditional medicine and really goes into in depth into healthy lifestyle. And she also has an additional skill that she has with acupuncture. So I am so excited to have Dr. Celine Lee on our show today. She's going to tell us a little bit about herself, and we're going to talk about, how we can minimize inflammation during this holiday season coming upon us. So Dr. Celine Lee, please tell us a little bit about yourself.
Hi, my name is Celine Lee. I'm a rheumatologist practicing in Murray. It's a suburb area of Salt Lake City in Utah. Yes, as Dr. Dada introduced, I am practicing in my own clinic that I opened about 1 year ago. But my journey as a doctor go way back to more than 20 years ago. And I started actually as a dermatologist. And at that time, I saw many skin diseases that was actually a tip of iceberg that told me about what's going on with the patient's body. So that really caught my attention, that how our body can tell us what's going on by showing these skin changes. So when I was working as a dermatologist, to be really help the patient from the root cause, I had to go deeper to see what's causing the skin problem in the first place. And I realized that a lot of skin diseases that I saw was coming from autoimmune disorders and rheumatology disorders. So I decided to study further. So after I came to the United States, I studied internal medicine and rheumatology and got board certified in both internal medicine and rheumatology, and have been practicing as a rheumatologist since 2016. And I'm currently helping my patient with those problems. But as I see rheumatologic patients, I found that it's actually a little bit more deeper than that, because a lot of people who have these autoimmune diseases have a lifestyle changes they can make. They can help their conditions. So our body's system is always interact with the environment. The environment will be like food or our activity levels, the air that we breathe in, everything is interacting with our immune system. So according to the lifestyle, we can make it better or make it worse. So this was so interesting concept to me, because it means that we have control over our condition by changing what we do in our daily life. So to study further about this field, I became board certified in lifestyle medicine and help my patient in improving their lifestyle. And I also was very interested about non-traditional, I'm from South Korea. South Korea, there's a lot of acupuncture. It's kind of one of the main, almost like, it's very common that people do it. And I was interested in offering acupuncture because it has its own way to help people by moving the energy more smoothly in the body so that our body can heal ourselves. So I started offering acupuncture to my patients so they can have the whole different way of help their body.
Wow, that is amazing. I think you are definitely a phenomenal asset for any patient to have in their arsenal. I think one of the things that you said that really resonates with me is just that there are things that we can be empowered, right, to change the things in our environment, in our lifestyle, that then impacts us. So we're not just, powerless, this thing is happening, I have no power, I have no control. We can do things within our lifestyle and with some guidance, really be able to kind of pivot and change the course of how our body either develops an autoimmune disease or develops chronic medical conditions, because we do have some control about things in our lifestyle. So talking about control and the lack of it, the holidays are coming. And so I'm here with my pen and paper. I'm going to take notes because we really want to talk about how we can minimize inflammation in the body, especially during this holiday season. So I'm going to ask the expert that one question and see, how many tips she can give us on how we can minimize inflammation in our system with this holiday season coming up.
Yes, so holidays is my favorite season of the year. Everybody become more excited that we can see our family and friends and get to spend some time with them. So it's a wonderful time of the year. And it's very important that we can enjoy this wonderful time with our optimal health. So if we have some body pain, joint feels stiff, then we'll not have to enjoy that optimally. So we want to make sure that our body is in the peak health so that we can really enjoy ourselves with our friends and family. So the holiday, when we think about Thanksgiving and Christmas, the first thing we think about is the food. So there are special food that we eat for holidays, and they're wonderful. But they come with some pros and cons. So they are very yummy, and we get so happy when we eat those holiday food. But I think everything's moderation. So some of the holiday food, they can actually make our joint worse, especially autoimmune diseases, joint problems such as rheumatoid arthritis or psoriatic arthritis, because of certain ingredient can set up the flare. So for example, too much of simple sugar in the food, it can cause inflammation because sugar is known to cause, sugar by itself, it's not a good ingredient for our body because it can alter our hormonal system, it can cause insulin resistance, but also for autoimmune disorder, it can cause inflammation. So if your gravy source is too sweet, maybe it's good idea to maybe reduce the sugar as much as you can so that you can still enjoy the gravy, but not, you don't have to have the joint flare. And also the turkey is interesting. So turkey, the white meat is better than red meat. However, everything's moderation. Exactly. If you eat too much of turkey, it can actually impact gout patients. So you have had a lot of uric acid. So a little bit of it's okay, but if you eat a lot of turkey, you ate the whole half of the turkey with a lot of gravy sauce, then it can actually cause suffering. So
yes, it can.
So we just need to be mindful about how much we eat, how much sugar we put it there. Also be mindful about processed foods such as pre-made holiday meals because it can have chemical preservatives.
So those are three very important things. So I think, in addition, so I'm just going to recap for our audience kind of three important things that Dr. Lee has mentioned. But I think in front of that is what she's really saying silently is you need to plan. You cannot just arrive hungry and just delve into everything. Like there needs to be a plan. What are the things that you plan to load your plate with? The things that she's saying is one, talk to the chef if it's not you, making sure things are not loaded with sugar. Moderation is what Dr. Lee is saying, is moderation is the key. So you can have some turkey, you can have some gravy, but you can actually even get lighter gravy that may be healthier. So there are always healthier versions. But we talked about, Dr. Lee and I are very passionate about gout. So one of the things she mentioned, if you load up on too much of that, both the gravy and the turkey, you can precipitate a gout attack. And that would be such a distraction from what you were planning for Thanksgiving evening. And so you certainly don't want to be in the ER with a gout attack. So things in moderation and finding alternatives on that beautiful table, the Brussels sprouts and the vegetables, maybe things you want to load up on. And then it's easier to be more moderate on, the turkey and the gravy because you kind of, abated the appetite a little bit is what Dr. Lee is saying. And so she talked about moderation, minimizing sugar, and basically we want to make sure that we have a plan. So so why don't I ask this? In addition to, what about drinks? Drinks.
Yes, the drinks is
What do you
also another,
drink?
yeah. Drinks is also another big portion because obviously there will be more alcohol in those holiday dinner tables. So um, one of the things that really set off this inflammation is alcohol, especially beer for gout patients. So if the beer is made with hops that can be metabolized into uric acid quite a lot because
Yes.
can metabolize into uric acid. So if you had a big turkey meal with gravy
Yeah.
sauce and
Mm,
push it down with beer, that would be just perfect storm for gout
perfect
attack.
storm.
And you
Yeah.
don't want to have a gout attack on Thanksgiving dinner because that will ruin your night. So
Yeah.
beer. So if you have to drink a little bit of alcohol, maybe a little bit of wine will be better than beer.
Yes. Yeah.
Yes.
Yeah.
Uh,
Totally. Yeah. Totally agree. And just for good measure,
soda.
Dr. Lee, I'm sure you've also walked in out through your training on Thanksgiving night. It is not a pleasant place to be. Because everybody, all the heart failure people have overloaded on salt. So they're there. So before they answer you and your gout toe attack, it may be gone, right? So it is not a good place to have to spend your evening, and especially on those holiday nights, because the ER is full, it's packed, and people with joint pains, even though they're in a lot of pain, they go to the bottom of the line. They're going to see the heart attack people and the stroke people first before they have time to look at the people that are presenting with joint pain. So just another reason to make sure that you really want to make sure that we're planning so that we are not in that situation where, oh, there's this acute 10 out of 10 pain, and then, we end up in the ER. So thank you, Dr. Lee. If you must drink wine in moderation,
Yes.
right? But
And also
avoid beer.
yeah, also soda too. Soda can also
Yeah.
gout attack. Yeah,
Yes, high
especially the
fructose. Yeah,
yeah.
high fructose corn syrup is exactly what Dr. Lee is saying.
Mhm.
Okay, so we have the food planned, we have the drinks planned. Are there dessert options, Dr. Lee, that you would recommend?
So the dessert is actually where a lot of people, oh, I have this big dinner, but dessert is just a very small piece. Um, and I like dessert too, but some desserts are really sweet, and unfortunately, it's impossible to make really delicious dessert without sugar. So we kind of need to think about what else we can do to reduce the sugar as much as possible and reduce the simple the carb like white flour. So for example, if you're thinking about like ice cream type, it's
Yeah,
probably better to do like fruit sorbet instead
yeah,
of like
yeah.
a caramel ice cream. There will be a lot of
Okay.
high fructose syrup. So, sorbet will be much less in sugar than regular ice cream that contains a lot of sugar. So that's a one option.
That's a great option. That's a
Yes.
great option. Yeah, yeah. Thank you for that.
Yeah.
Okay.
Just like the fresh fruit is also good dessert.
Yeah. Because you can call you, they're so colorful, right? That you put some fresh, colorful fruits in a bowl. You don't really feel like you're being deprived, because that's part of it. Is a sensation of feeling that you're deprived. Why can't I just have all of it?
Yeah.
Is planning, thinking about your body, thinking about the fact that you're making decisions that are going to impact your quality of life down the line. And so I
Yes.
think those, just feeling empowered, right? That this decision I'm making is going to make a difference. Dr. Lee?
Yes. Yeah, that's correct. But I understand the cultural aspect of these holidays. For example, pumpkin pie is really important, and we feel the festive mood of Thanksgiving by eating pumpkin pie and turkey, right? So you
Yes.
can still eat pumpkin pie, but just when you make the pumpkin pie, try to reduce the sugar as much as possible. So
Yeah.
if it hits your tongue and it's just very sweet, maybe there's a little too much of sugar. If it's just kind of pleasant, it's not too sweet. That's probably better amount, and you can
Yeah.
eat just a little bit. You don't have to eat the full pie You can
Yeah.
slice it. You can have a
Yeah.
little bit of taste, so you can still
Yeah.
enjoy those food
Yeah.
to feel the culture and the festive
Yeah.
mood, but you don't have to set your arthritis off the roof.
Yeah, yeah. That is such a good idea. And the other thing that I was told, which is a good idea, is, so for me personally, I'm going off to family, and I was like, well, they're going to be expecting me to eat, right? But the other thing, nobody cares what you drink. So you can bring your own drink. Right? You can bring your own low sugar, something because nobody cares whether you drink, because most likely they didn't put a lot of effort, even if they made a punch, right? Or they bought alcohol. Nobody really cares what you're drinking. So that may be another way in which you have complete control over what you drink, and you can avoid those high fructose corn syrup things. You can avoid the beer because you brought something that is going to be healthful for your body. Because we get trapped with the drinks, right? Because you're just drinking mindlessly, right? Because we're drinking, we're talking, we're laughing, we're connecting, we're being grateful. So thank you so much for those, Dr. Lee. Can you tell us about a patient that you've had that's just generally had a really good experience or really good outcome after working with you? Because people like to really hear other, I think our audience like to hear, kind of the experience that other patients have had, because they kind of identify more with that. And so if you have kind of a patient that you think has had a really good experience, we'd love to hear it.
Yeah, it dawns on me. One patient I saw about 3 to 4 months ago. So she was she was a patient who have a lot of joint pain and body pain and stiffness. And so she would just wake up and she just feels so just yucky. She doesn't feel good. She feels stiff. She feels achy and she cannot walk very well. And she felt like she was like Tin Man. And nobody was able to find out why she had so much of a problem. Because her joints were actually not that swollen visually, but they were so painful. Her sister was also my patient, and her sister told her maybe get an evaluation. So I saw her, and she had a lot of pain, and she was almost crying. And I did the evaluation. I spent quite a lot of time with my patient in the initial consultation.
Yeah.
I spent about 90 minutes with the patient doing the full history and full physical exam. I also do the full dermatology exam. And while I was doing the physical exam, I saw a little, about like this size, very small patch that was hiding inside of the hair in the back of her head. And I
Yeah.
looked at it, and there was psoriasis. So,
Wow.
this looked like a psoriasis.
Yeah.
So she actually had psoriatic arthritis. So I gave her
Wow.
treatment for psoriatic arthritis, and her joint pain improved within about a few weeks. So
Wow.
she was really happy because she does not
Wow.
have the pain anymore. So
Wow.
I was very happy that she was a young woman. Should be really
Yeah.
enjoying life, but she
Yeah.
couldn't do it for many years because of this
Yeah.
sneaky disease that was hiding.
Yeah.
But I
Yeah.
was very happy that I was
That's
help her so she can
That's
enjoy.
that is a brilliant catch, right? Because she could go on for years, right? If you didn't catch that, when nobody is, because if you don't have the skin lesion, it's very difficult to turn around and make that diagnosis, especially if you're not a rheumatologist. So kudos, excellent work, catching that, because sometimes that's hard to find, as another rheumatologist talking to make that diagnosis without the skin is really hard. So, so kudos to Dr. Lee, and I'm so happy for your patient, right, that she got the right diagnosis. And, with psoriatic arthritis and psoriasis, we have so many good treatment options, everything from lifestyle modification all the way to medications that alter that overactive part of your immune system. So that's a wonderful story. I'm so happy for your patient. So my final question, Dr. Lee, is if you had a superpower, what would it be?
um, I I want to be either fly or teleport myself
Oh,
because
what?
or just like a Star Trek. I want to be able to just jump the space.
Oh, cool.
Yeah, because I still have my family in South Korea, and
Yeah.
sister, I have sisters, and one of the sisters live in Denmark.
Oh,
So it's
yeah.
difficult for me to see me. I need to go to South Korea or Denmark to see
Yeah.
them.
To
But
see them. Yeah.
it would be really nice
Yeah.
to just jump the space.
Yes.
And
Yes. And transport.
yeah,
Yeah. Yeah, yeah, I totally understand that, especially with the holiday season coming in, right? Really a time for families, and you want to be in Denmark and South Korea at the same time. Yes. Yeah. Well, Dr. Lee, thank you. This has been so helpful, especially, planning for this holiday season. So if people want to find you, how do they find you? How do they work with you?
so I have a website of my clinic. It's www.lotusrheumatology.com. So lotus like the flower lotus, the one
Yeah.
flowering the pond. So
Yeah.
lotusrheumatology.com. And I also have a YouTube channel called Lotus Rheumatology. So you can go to either my website or YouTube channel to find me.
Okay, perfect. So, we're going to actually put that in the show notes. So thank you so much, everybody, for listening and watching. I am Dr. Arinola Dada. If you're in the greater Seattle area, look us up. If you're in Utah, look up Dr. Celine Lee. We work as a national team, right? So we are help to help you. If I know anybody show. If you think it's been helpful, share it and follow us on our channel, Healthy Joints, Healthy Lifestyle. Thank you so much, everybody.
Thank you.
Thanks,
Bye.
Dr. Lee.
Have a happy Thanksgiving.
Yeah.